Welcome to Health Options. Findings show that malaria, diarrhea diseases, HIV, neonatal and lower respiratory infection are the top 5 causes of premature deaths in Nigeria. On this edition of Health Options, we focus on disease prevalence in the country and efforts at stemming the tide. Join us on our complementary segments where you will get to know about useful health tips on malaria as well as managing constipation the natural way on our nature scanner. Thanks for joining us on the program. I am Rabi Abdallah. With me to discuss disease prevalence in Nigeria and efforts at stemming the tide is the Chief Consultant Epidemiologist of the Federation, Dr. Godwin Ntadum. We're glad to have you join us on Health Options, Dr. Ntadum.
It's my pleasure to be here. Thank you.
Yeah, so the focus is on the disease prevalence in the country, and we know that Nigeria is still a country that boasts of disturbing statistics. The question is here, why do we have high disease prevalence in this part of the world?
You can link this to lifestyle, the region of the world, the tropical regions. If you look at some of the diseases, you see them more within the tropical regions because of the temperature, the humid condition, and the rainfall patterns. All these contribute to what promotes it. But most importantly is the education of the people, the lifestyle, and the control measure, the preventive measure, how serious we take them. So all these contribute to the problems we are having presently, globally, especially in the tropical regions of the world. Okay.
As the Chief Consultant Epidemiologist of the Federation, we are supposed to have statistics of these diseases, and are we really doing well in that regard? Yes, we know the 5 major causes of death. So how are we faring when it comes to real statistics? Because there's been so much controversy in this regard. You have the development partners giving us ours, and in country we're coming up with something different.
Well, like I must say with all sincerity that we have some little challenges when it comes to data in this country, and we are working towards that direction. And primarily we have some of the diseases that are like coming as epidemics. Some of them are the routine conditions that we are used to. Like when we talk about the non-communicable diseases, data are generated at the state level, and these data are brought to the national level. We indeed have data, but like I would say, they may not be perfect. Now,
are you working towards perfecting
we are? Yes, we are working. We are linking up with like the federal government has been able to develop a reporting form which has been circulated to the local governments area. This local government, they report to the state, and the states report to the national level. But again, because most of the conditions don't actually get to the hospitals, which is a major challenge also. You can see when a partner chooses to work in one local government or a state, they probably provide all the required materials to get the correct reports. So you may see an improved reporting from such areas. But we actually depend on the routine reporting, which is done by all the state epidemiology units, and is reported to the national. What
do we do so that we have to nip this things in the bud before they spread and become epidemics, like we've been recording in the past? Is there anything differently that you're doing now?
Yes. You see, you have to look at some of the etiology of these conditions. How do they come up? Like you see cholera, sporadic cases of cholera reporting in some states, in some areas. And when you come to cholera, you talk of the lifestyle of the people, how they live. It's a disease which is directly associated with hygienic situation of that environment. Like when you see the transition between the dry season and rainy season, that's when you begin to see many fruits like mango coming up, and you see most of the time some of these come with a lot of flies. When you go to an environment where they have open defecation, where people go, no toilet facilities, people go to the environment, of course these flies come to perch on this, and from there they move to our homes, to our living, eating places. And of course that is where you carry the flies actually carry some of these germs that are responsible for these diseases and take it home, contaminate the food, and people eat it. Of course, when it begins from one area, it spread. They are living things. They begin to multiply rapidly within the system, and as many people that come in contact with this, they develop the disease, and it goes on.
Malaria is another leading cause of death too in this part of the world.
Yes.
So what are those factors too?
Yeah, malaria is very unique. Like when you talk about the number of people coming down with malaria, you can relate it first with the environment, with the vectors, and generally with the attitude too. We are all familiar with the vector causing malaria, which is mosquitoes, yes. The female Anopheles mosquitoes. Yes. And like we keep on emphasizing, for a mosquito to infect an individual, that mosquito must have been infected. So the mosquito must have bitten somebody who has the parasite or who has the germ, as the case may be, and in the second bite infect a person who does not have the parasite. So what we'll try to achieve is to break that link of not allowing an infected mosquito to bite a healthy individual. And what are the things that promote mosquitoes in an environment? You talk about the way we live also, allowing for receptacles for water in our environment. Again, it links to the rainfall pattern. When the rainy season is about to begin, or when it begins, you begin to see more receptacles collecting water in our environment. If we do nothing about it, the mosquitoes go there, they lay their eggs, this egg hatch, and they must feed on blood. They have to come after us. And again, the way the infrastructures in our environment, how do we build our houses? Do we have window screens? Do we sleep under insecticide nets? All these, they matter a lot. By doing all these measures which are preventive, they naturally will reduce the number of cases we have eventually.
Okay, let's take a look at malaria again. The prices of anti-malaria drugs seem to be under increase. It's rising, becoming so expensive now.
Yes. Nigeria has benefited significantly from support from Global Fund. From 2005, Global Fund has been supporting the country. 2004, 2005, and it went on. And one of the strategies that was adopted was to reduce the cost of anti-malaria medicines, because everybody does not go to the health facility. Some people will still have to access the medicine from the private sectors. A proportion will go to the health facilities. These are given free to all the people who patronize government public facilities. But a huge proportion of these medicines are equally made to go to the private sector. And that is where you have the affordable medicine facilities for anti-malaria. What Global Fund was practically doing then was to subsidize the cost of this medicine from the factory level. That means the Global Fund will pay about 95% of the cost of this medicine at factory level. So it comes to us at almost 5% of the actual price.
So has that changed now?
But this support has been removed now. Global Fund does not support the private sector mechanism any longer. So it is like the medicine is coming directly from the manufacturers at the cost they should be. And that was why suddenly from a price of 150 naira, 100 naira anti-malaria, it has moved to maybe 800 naira, 1,000, or even going to 2,000. Yeah. So the support provided by Global Fund is no longer there for the private sector.
So isn't it high time we take charge, ownership? Isn't that possible?
It is very possible.
Yes.
Malaria is one of the biggest health problem in Nigeria. And you can see that malaria contributes significantly to the low productivity of people.
Definitely.
If you look, people don't go to work. What is the cause? They are sick. And when you probe further, probably they have malaria. And again, you can try to quantify the cost of an individual not being in the office for a whole day, not being in the market, or not being in the school.
Okay, so in the face of all this, now what are we going to be doing differently, or have you come up with a different strategy towards like we're looking at ways of stemming the tide of disease prevalence? Is there anything new that Nigeria is looking at the moment?
That is generally across all diseases, especially the diseases that will lead to maybe epidemics, outbreaks, and others. The government is doing a lot. One of the things is to mitigate some of these factors, to go at the lower level, start with preventive control. What do we do to prevent even this outbreak? What do we do to prevent cholera from occurring? What do we do to prevent meningitis? So we have to look at it as a whole, and that is an area all the time. Prevention is always better than cure, like we are all used to.
There's so much talk about complacency on the part of states, not really doing the needful.
Yes,
rather allowing the federal government to do almost everything.
Absolutely, you are right. The issue concern, especially when you come to some diseases that have been supported by Global Fund, like HIV/AIDS, tuberculosis, and malaria. This support is not meant to take over the role of the government, state government, or the federal. Is to complement whatever the state is bringing to the table. But over time, we've seen a situation where the states, except for a few states, we abandon the whole process of controlling these diseases to Global Fund. And Global Fund can never give you 100% of your need. They either give you 20, 25%. And if you use that 25% to service what 100% needs, it can never be sufficient. And that's why you see some challenges of run out of stock and several other challenges, because the state has a big role to play, especially in the area of prevention. Then also to provide enough medicines. That's where it's done elsewhere, where the government provide the medicines, and whatever is coming from support from partners is only complementing what the government has provided.
And you don't have any mechanism in place to ensure that the states play their role as expected or required?
I must tell you, some states are working very hard. I can mention Lagos State. Lagos State has been doing very wonderfully well when it comes to disease control. That is putting mechanism, buying their own medicines. Rivers State at the time was doing this also, and few other states in the northern part of the country where they purchase medicine and they purchase diagnostics. And of course, we know there are challenges with resources even at the state level. But again, the system should be in such a way that the state government, the local government. There was a time in Cross River States where even the local government was coming out with resources to support disease control. Part of their resources was being used.
Okay, so what we expect states to do more than they are currently doing.
More states should actually
when it comes to stemming the tide of disease prevalence in the country.
Absolutely.
Okay, thank you so much, Dr. Ntadam, for coming on Health Options.
It's my pleasure.
We look forward to having you again.
It's my pleasure. Thank you very much.
All right. Nigeria suffers the world's greatest malaria burden, with approximately 51 million cases and 207,000 deaths annually, while 97% of the total population is at risk of infection. Here are some health tips on malaria.
People should sleep under bed nets. And then for pregnant women, we also say that they should, immediately they know that they are pregnant, they should go to the health facilities so that they can start from the second trimester giving them intermittent preventive treatment using sulfadoxine pyrimethamine. This is usually given from the second trimester every month until the woman delivers. The environment is actually the source of breeding of these mosquitoes, and so what we tell people is that they should take care of their environment, manage their environment very well. And the way to manage it is to make sure that the stagnant water is not left. Because once you leave stagnant water, it will breed, mosquito will breed on it. Actually, a mosquito can breed in very tiny sources of water, very tiny. Even the crown of a bottle, you can breed there. Tires and all that. So when people make when they come back to their household with tires and containers, it's not too good. They need to throw away some of those things and make sure that their water containers are covered so that the mosquito does not breed. Because if it breeds there, it can fly off. Actually, mosquito can fly up to 5 kilometers. So, and then it needs a communal effort. While you are doing your own, your neighbors need to be doing their own. Clear all those gutters and clear all the, whether it's clean water or dirty water, then you have taken care of the breeding places for the Anopheline mosquitoes and the colicines. If you wear long sleeve and all that, you prevent, you reduce the biting. Larvicidin actually it's effective, but it's capital intensive because there's a lot of things you need to do, a lot of places you need to larvicide, but it's of course effective. Then indoor residual spraying, when you take very clear, skillful spraying of particular insecticides on the walls, so that when the mosquito comes in and wants to bite, usually when it bites, it rests on the wall. When it rests on the wall, that insecticide will get into it and kill it. When somebody gets a feeling that he has malaria, usually what comes is that feeling of fever, malaise, that feeling of not feeling very well. Some may have headache and abdominal pain. Usually children have abdominal pain more than others. Or that kind of feeling of, look, I can't do anything. The best thing to do is to go for testing. And it should be done within 24 hours. For children under 5, malaria can actually kill them within 24 hours. Yeah, and it's a very, very bad one, because if you leave them, they can slide from just uncomplicated malaria to severe malaria. And then suddenly you see that the child is vomiting, everything, and is unconscious and all that. It goes very fast. So the best thing to do is to, within the first few hours, take their child to do RDT, rapid diagnostic test. When it's positive, they should receive treatment immediately. We'll talk about prompt treatment. Prompt treatment that happens within 24 hours. That is what we are saying, so that malaria does not progress to severe malaria. And prompt treatment is with artemisinin combination therapies. One other important thing is that when they start taking it, they should ensure that they complete the treatment. Usually what happens is that when people come in, and because the drugs are very effective, artemisinin combination therapies are very effective, immediately they start taking it, it clears the parasite biomass. It brings it down fast within the first few hours. And so they sweat and they begin to feel all right. And some people can go home and say, look, I'm okay. We said they should take it for 3 complete days, complete the treatment. If you see somebody who is not completing the treatment, what he's doing is that he's allowing low concentration of these 2 drugs to remain in the body, a concentration that will not kill the parasite and will also not remove them. So it's acting, but it's not killing the parasite, and the parasite uses that to learn how that drug works. And if it happens, then the parasite begins to learn about resistance, begins to develop resistance and all that. And that is what happens, what has been happening in several countries, and we don't want it to happen here. Luckily for us, we don't yet have issues on resistance. Self-medication should be discouraged, and then medication without diagnosis.
Your body must get rid of what it does not need, along with toxins that may be consumed with food. Imagine what happens when all these toxins are jammed in your colon and going nowhere. The toxins are left to lie in your digestive tract, and the dangers can be many. The most common is cancer of the colon. Let's find out what nature offers when it comes to dealing with constipation on Our Nature's Corner.
Constipation is something that almost everybody has experienced one way or the other. The truth of the matter is there is no prescription to the number of times you should move bowel in a day. The type of activity you engage in also affects how often you move your bowel. The type of food you eat also affects how often you move your bowel. Ways by which you can generally take care of constipation without going to see your doctor is, in a natural way, is that fruits and vegetables, because fibers, taking a lot of fiber helps to in bowel movement. A lot of us go to pharmacies or even patent medicine shops to get drugs once we think we are constipated. And there are so many drugs actually in our health facilities that you can use for constipation. But most of these drugs are chemical entities. And that is what we want to address, because all of these drugs are imported into our country. Whereas if we look at our environment, you see that we have a lot of our medicinal plants that can be used. There are several medicinal plants in our environment, I'm going to show you some now that we can use in management of constipation. The idea here is not to tell anyone that these medicinal plants I'm showing you, you go to the backyard or go to farm, you cut it and go and squeeze it and start drinking it. That's not the idea. This is powdered product obtained from Cassia alata. In Hausa, it is called Filascan. It is very, very effective in constipation. In fact, what we call very extreme constipation can be handled by a product obtained from Cassia alata. This is called Gueria senegalensis. Gueria senegalensis is a sabara. Is also very effective in constipation in this form. These have been developed to the form that they are all the doses that are required to be taken are already known. That is the difference between you going into the farm to get these plants and start squeezing it or pounding it or putting it in a can. The truth is, you do not know the quantity you are taking. Well, that's what we call dose. And that's where science and technology comes into play, because we need to know the dose you are taking, because the dose you take is a function, it depends on your weight, your age, and you know, a lot of other factors, which we take into consideration when we are developing this product in a scientific way in our laboratory. This one is called Ricinus communis. It's very, very popular. Ricinus communis leaf, the popular castor. This is the leaf. The seed is used for other things. The last here is called Diospyros mespiliformis. It is a Kenya. Yeah, in Hausa, that is the name. A lot of our people in our rural communities use these plants the way they are. Some of them, like these leaves, in water or in local gin. Allow them to macerate, we call it maceration, in the soak, and after some time, they drink the extract, and they are relieved of the constipation. We do not need to import anything. All we need to do is to go to our farms, our agricultural farms, harvest these things, take them into the lab, and then apply modern science and technology to convert these products to our own indigenous Nigerian medicine.
That's the size of our package on this edition of Health Options. Remember to observe personal hygiene, eat healthy, and keep your environment clean. You can go to our YouTube channel to watch the upload of these and other episodes, and email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. See you again.